Hello and welcome to the CX Files podcast for 31st October 2024. It's Halloween and I'm Mark Hillary here in Sao Paulo.
And I'm Peter Ryan in Montreal. Mark, happy Halloween. Do they celebrate Halloween as we would say in Canada, in Brazil?
Yeah, absolutely. I think this American idea of everybody getting pumpkins and putting skeletons in their yard and everything, I think that's just gone completely global now because when I was growing up in the UK, Halloween wasn't really a big deal. And my
Hmm.
wife tells me it wasn't that huge in Brazil either. But I think that, we've seen so many movies and TV shows from America over the years that suddenly it all gets picked up over here.
It's the Great Pumpkin, Charlie Brown. That's the one. That's basically the Halloween version of a
Mm,
Christmas movie, I would say.
yeah,
It doesn't matter the bog standard one around the world, but
yeah.
I can remember growing up in Saskatchewan. And it would not be uncommon for us to have freezing cold temperatures and snow by Halloween. And we'd be out with our winter coats on over top of our costumes. Or if you were smart, you had a larger than necessary costume. You put that on over your winter coat.
Yeah, that would make sense. And I was thinking, actually, wasn't this all imported from Ireland originally anyway? I think the whole tradition of the death images, the skeletons, the scary pumpkins, and that, I'm pretty sure it came from Ireland and went with Irish expats out to America.
Yeah, highly possible. It sounds like a very familiar story. I can recall living in Ireland. I don't re I don't remember when I was there any type of Halloween celebrations. Mind you, I wasn't really probably either in the festive mood or I was probably a little too old to be going out trick-or-treating. But it is truly a global phenomenon and a very exciting one at that. But before we digress further into any more Halloween stories or any more tales of Halloweens gone by, I am really excited this week to welcome our CX Files guest. Now, it's a lady who I had the chance to interview in the last few days by the name of Tanya Scotece. Now, Mark, I don't know if you follow Tanya on LinkedIn, but she has got one of the most exceptional LinkedIn profiles that I've seen in terms of the content and the commentary she puts out there. Now, Tanya has a couple of different roles. She's working currently as a professor and the program coordinator of funeral service education at Miami Dade College, but she also has a role as a senior placement specialist for a senior care network in Florida. The reason I caught up with Tanya is because of the fact that one of the sectors of CX that I think we kind of miss out on when we talk about the industry on a vertical by vertical basis is what I would call compassionate services, whether it's bereavement, whether it's managing the elderly or the aged or people who are seniors. And Tanya comes to the table with a very unique perspective, being intricately involved in both these different elements. Mark, I don't think it's unfair to say that both you and myself have had experience in both the elements of family bereavements as well as senior care placement the last little while. And I think anybody who has been exposed to this on a firsthand basis understands the need for compassion, for sensitivity, for that high level of touch point from people working in these sectors. And Tanya talked to me a little bit about what her experience has been so far, what she sees as the most important facets that somebody can bring to a role if they're getting involved in compassionate or care-based industries, and really what her vision is in terms of where the space is going and what those who are in a frontline role need to be thinking about from a CX standpoint. And you'll hear over the course of the chat that at various points, I will say we're using CX or we're using customer care or the term customer or consumer in the very broadest term, because really, I think when you're going for the bereavement services side of the equation or for senior care, it goes a level beyond just a simple customer.
Yeah. Well, of course, this is a sensitive area. I mean, right now, I'm actually looking for a care home for a family member of mine, and that's definitely a very tricky experience. And my mother died almost exactly 1 year ago,
Yeah.
as this podcast goes out, and so I was flying off at short notice to the UK last year, around this time, for her funeral, and also trying to help my brother and sister organize that, because my
Yeah.
dad was sort of completely out of action and couldn't handle the process. And you can see how the difference between a compassionate uh, operator that can help you sort of get through this process, and you can also see the opportunity for uh, well, not to put too fine a point on it, but cowboys to exploit
Hmm.
people when they're
Yeah.
they're in a very vulnerable position. Because when you're being offered, do you want gold on the coffin, or do you want brass, or what type of wood do you want in the coffin? It's the sort of decisions that often you don't want to be making when you're grieving. You're
Hmm.
immediately grieving and suffering, and this can be very difficult. So yeah, you need a lot of compassion from this kind of service provider to really help people through this.
Absolutely. And this is some of the fodder that Tanya touched on over the course of our chat. And one of the things that she brought to the table, when we were having this discussion, this very fascinating discussion, is the need for individuals not just to be sensitive and caring and coming with a real high level of touch point. It's also how they present themselves, the manner in which they need to reassure, and that comes down to how they dress, what the fashion sense is, and she indicated that, believe it or not, this really counts for a lot. So I think that as we dive into the interview that I conducted with Tanya, there's a lot of very important takeaways in a couple of different sectors that again, I feel are not talked about enough from a customer or a CX standpoint, but hopefully this will get the discussion going.
Yeah, okay, absolutely. And just to throw in a final point there, but I read a book recently about working in a crematorium. It was an American young woman who got a job in a crematorium almost just to see what it was like, because it seemed like such a unusual customer service environment. And she found that you can make an incredible difference with grieving families just in the way that you interact with them. And off the top of my head, as we're recording, I can't remember the name of it, but I'll try and find it on my Amazon list and stick it in the show notes. But it's really relevant to this discussion.
Great stuff. Well, then, why don't we just go to the chat that I had with Tanya Scotece? And I think that, as I say, it'll be enlightening and certainly the opportunity to hopefully have more discussions of the similar nature. The CX Files has a very special episode this week. I am delighted to be joined by Tanya Scotece, who joins us from her home in Miami, Florida, one of my favorite cities in the world. Tanya, great to have you here, and thanks for joining.
Thank you so much, Peter. It's a pleasure to be here with you this morning.
Well, listen, one of the reasons that I wanted to bring you onto the CX Files, and you and I have been trying to make this work for some time now, and I'm so glad that we were able to, is because of the fact I think you've got some amazing engagement on LinkedIn, and I truly enjoy the posts you make. And you come to the CX Files from an angle that I think is one in the domain of customer experience that's not discussed nearly as much as it probably should be. So, as a starting point, Tanya, I know that you wear multiple hats in terms of what you do. Maybe could you describe to us a little bit about the different roles you play, and then we'll get into a bit of banter, a little bit about how you approach CX from the different industries and elements that you come to us today with.
Sure, sure. So I am a full-time professor at Miami Dade College, in at the North Campus in Miami, Florida. And there I oversee the mortuary program, which is for students who want to become funeral directors and embalmers. It's very legalized in the United States as far as being licensed and credentialed to be able to work with families who have lost a loved one. Second, I also am very much involved with the senior community. I do senior placement, and that looks like matching people with communities who can no longer live alone. So, in that capacity, a lot of the families are in crisis. Someone will get a diagnosis of dementia, maybe a hospitalization, and we are a free placement agency matching people with communities. And I cover the East and West coasts of Florida. And in addition to those two roles, I also serve as an expert witness for funeral home and cemetery litigation cases. Been doing that for several years, and I feel like I speak for the deceased. So it's a very reverend position that I hold, and making things right in the world.
Well, that's fantastic. Thank you so much for that overview. And that leads me into the first point of reference I'd like to discuss today, Tanya. You know, you've made a career out of working in a number of different sectors, whether it's bereavement or senior care and helping seniors who've been going through a very tough time. That quite frankly, these are sectors that require a great deal of sensitivity. And I'm not sure if using the expression customer is the right in either one. I mean, obviously, deceased and the deceased family members, there's certainly patients and the family of the patients. But from the standpoint of how you interact, if we're to use customer experience or customer care in the broadest sense of the term, what do you feel are the most important facets of managing those types of interactions with the so-called customers that require assistance, and in some cases, very sensitive and very urgent assistance in these different sectors with which you play?
So great question. I would say one of the top skills is probably from the standpoint of expressing empathy, right? Actually expressing empathy and being able to identify and listen to a family, we'll use that word, a family's maybe, concern, question, and very gingerly providing options to help them understand what the options are in that situation. One interesting caveat to that is especially with the mortuary science students in school, sometimes they're coming in from a very macabre sense, like shock value. And when we're dealing with funeral home setting or even senior placement, it's somebody's loved one, right? They're not looking for macabre sense. So it's I would say the top one is empathy, active listening, high up there, and being able to really understand and identify what a family is experiencing and how we can match the resources that we have to their situation.
That's really interesting. In terms of what you've outlined there, and I think you've got a very unique sense of this as an educator, as well as somebody who's practiced these elements. So, Tanya, from the perspective of your role as somebody who will be working with students and so forth, what do you think that the students should be bringing to the table? What are the qualities that you would be looking for in terms of somebody that would be able to have that level of empathy, that would have be able to have that area of sensitivity, not coming at it from, as you say, macabre or even a scientific aspect, but really the fact that you're going to be dealing with bereaved individuals who are truly upset about a family or family member or a loved one or a friend that's passed away. What are the qualities that these people should have? And I think a very important one from the standpoint of how they deal with individuals going through a very tough time. Are these qualities instinctive or can they be taught in the classroom? Can they be learned? What are your thoughts?
So, my thoughts are as follows. I believe that there is a great deal of the soft skills. And the soft skills, I would say the top one in both arenas would be honesty. Honesty in the delivery, honesty in the expectation, and truly just having a pure heart to genuinely help somebody. So there I see it in the students as far as, really just upholding like good citizens and just making people have the trust capability, trustworthy. When I was a hiring manager for many, many years at two funeral homes that we worked for, one of the actual, things that kind of go through your mind in hiring people is, would I want this person taking care of my relative? And, so it's kind of like, putting ourselves up close and personal. And if the answer is no, it's like, well, why? Like, what is that person lacking? Or, what is not conveying properly? And interestingly enough, at the college, we have about a third of the students coming in with, I would call it the goth-like. I actually did my dissertation for my doctoral degree on goth-like appearances with visible tattoos and body art. And it's fascinating because once you can get beyond or through that exterior, most people are very kind and nice. However, what I tried to convey in the classroom is that it is not what people take away on an initial contact. And in funeral service specifically, we have one chance to make a funeral right. It's not a redo. It's not something we can go back to say, oops, I'm sorry, let's do a redo. Let's start again tomorrow. It's you have one chance to have a customer experience top notch right out of the gate. Senior placement, very similar as far as, matching people with communities. It can be very traumatic for families and individuals to move loved ones. So making sure that we're listening to what the concerns are, the best choice for them based on price, based on location, which is again very similar to the funeral service realm as far as presenting options and having families decide. So another, I would just want to share one last topic on this specific facet is also knowing when you don't know something. So, I mean, in the classroom, it's very, we're not content experts in every specific facet, and being able to say, that's a great question. I don't know. And I'm not expected to know it. There's proficiency levels. So I think for people going into areas that they're new is also very important to understand what they don't know.
Yeah, I've always been a big believer in knowing what you don't know is just as important, if not more important than what you know. And, it goes down to the old adage, and I know it's a cliche, but no question's a dumb question. If you don't know it, you've got to ask. And, that raises a question for me, Tanya. Obviously in both the funeral services sector and in senior care. And sorry, this is not one of the questions that you and I had bantied about on email over the course of last week, but it's just come to my mind. But I think it's an important one. As somebody who's been in the funeral services sector for some time, and you've seen a lot, what is the impact on consolidation been? The fact that, we're seeing less and less locally owned funeral homes, less and less, say, local sensitivity, and more of the conglomerates hoovering up these different entities. How has that impacted the whole experience as somebody who might be coming with a bereavement? Has there been an impact on the level of service or how service is being delivered in that sense?
Excellent question. I'll answer that by saying it's people driven. Okay. So, and what I mean by that, it's at the top, you have people. And whether people are working for independent funeral homes or corporations or shareholder type, it's managed by people. And when you have great people, great leaders, people can lead any type of organization, corporate, private. It's kind of like taking the airline industry or restaurant industry, same conversation, right? Just different topic. For example, restaurants and hotels, whether they're privately owned or corporation owned. So when I think the customer experience, if you have great leaders, you can be successful in either one. Where I think things start to break down in the sense, and when I'm referring to things, it's the sense of what is the brand, what is the target for that specific community. That's where I think the breakdown is. So I'll answer it in that answer because I see it just because it's people driven. And there's great people on both sides. You have great people running independents, great people running, the corporations. But when you get a few of the bad seeds, as I'm going to call them, it kind of trickles down, it trickles up, and it infiltrates. It's a toxic work environment. So I've seen it, been privy to many situations on that. I do my best to identify those behaviors and kind of remediate that very proficiently. But if you're in a position that you need, additional support from management, then that's a bigger conversation.
Tanya, one of the things that we've observed across different sectors is that there is a very different approach amongst consumers, whether it's a telecommunications consumer or a travel consumer or a banking consumer, an insurance consumer, you name it. There's a lot less patience. There's a lot more willingness to engage in what we call customer rage, which is a real thing. And a lot of people like to say, oh, this is a post-pandemic phenomenon. I'm not quite sure that it is. We were actually observing a lot of this pre-2020 as well. In terms of the senior placement or the bereavement sector, are you observing some of these similar challenges as well in terms of how again, and I use the term very broadly, customers or consumers will come to a funeral services home or to a senior care home and have a different approach in how they're going to behave relative to what they might have done a few years ago? And if that's the case, how do people on the front line respond to that?
Mm-hmm. So from my perspective, most people, I'm going to use the term most, coming to, let's say, a funeral home with somebody that has just passed away in their family, the level of what they're bringing to the table has to be identified. So, for example, many people are lack of sleep. Maybe they've slept in a hospital for a week with their loved one or in a hospice situation. They're not eating, they're not drinking, they're dehydrated, they're just all over their place. They could have, unresolved issues with their loved ones. So there's other complications and factors, guilt, shame. Then you have the whole financial piece. Sometimes it's unexpected. So now they're coming to a table, they're tired, they're hungry, they're grumpy, they're upset for all of these reasons that I just brought to the table. And now they're putting their trust, and that's another key word with the trust and confidentiality aspect. How did this person pass and where is this information going? So that is something that we really hone in the classroom for the mortuary program to help our students understand that most people, it's the majority, it's not a happy time for them. Occasionally you'll get somebody, for example, they're happy that their mom lived to be 100 and she passed away in her sleep and the family is relieved. But that's not the majority of families that we see. Then to kind of piggyback with senior placement, many families with senior placement are also in a crisis situation. Their loved one has been in a hospital, perhaps get a diagnosis of dementia, loved one can no longer live alone, and all of a sudden the family's scrambling, like, where do we go? How much is this going to cost? What does this even mean? And again, with those same emotions, maybe they've had lack of sleep, they're just frustrated. And being able to sit with a professional that can listen and identify what their needs are, present options with zero benefit from the delivery of the person who's delivering that information, in my opinion, is paramount. So I've never been one for, I know I'll set some controversy here as far as, commission-based sales with funeral directors. In my opinion, it's almost like this oxymoron. It's very controversial topic. So I think the key components to identify with families is they are looking for answers. We all have access to the internet. Sometimes the internet can present good options and sometimes, varying degrees. So I think as educated professionals, it's very important to listen to what a family is looking for, identifying the challenges, also, those active listening skills, summarizing, paraphrasing. Because again, I think if somebody's answering a question that wasn't your question to begin with, you're going to get very frustrated, or the family will get very frustrated. So in my opinion, those are the key areas that I see identifying what the family is needing, how we can be a benefit, and without pressure. These are like major commitments also. So it's kind of like, buying a home or a car. I mean, sometimes, you may not want to walk into a funeral home coming out with a signed agreement, and that's okay. But it needs to be educated to a family that you don't have to make a decision today, and to give them back that control to where they feel that because they're out of control with their immediate situation. Somebody passed or somebody needs placement, and to give them back that control. And I'll always refer to our state statute in Florida as far as chapter 497 with regards to the decedents. It's referring to dignity and respect. You have to treat everybody with dignity and respect. And I think those are the key components in the classroom. It's not the content, it's not the, material as far as, what they need to know, but how to deliver information in a very concise way to a family in need.
You kind of actually dove into the last question I wanted to bring up. So I think this is a perfect way to set it up, Tanya. From the standpoint of the students that you're teaching, so from the standpoint of people that are aspiring to a career in funeral services or even in senior care, I'm curious, what advice would you give them in 2024 and beyond in terms of what they should expect and what they need to bring to the table with regards to how they're going to interact in a very sensitive situation with family members or potentially people that are in the early stages of dementia? Uh, how do they act? What would you say to them in terms of what they should expect and what they need to bring to the table?
So, two answers to that question. One is to really look at themselves as far as what they are projecting on their social media. Number one, as far as, like the macabre sense, I mean, you're talking about people with sensitive situations entrusting their loved one for your expertise. So people will Google people will look at their Facebook, and sometimes people don't get hired for these exact reasons. So how they present themselves in the community, these are not jobs that, you just put a suit on and you show up and now you're a funeral director or now you're a senior placement specialist. People start looking and they expect people to look at a certain way. So when people come in, and I'm not saying that people with, diverse colored hair and tattoos and piercings won't get hired, but to a traditional family that's perhaps in their, 70s and 80s, that's not what they are looking at for trust. That's not what they see as credibility. So being self-aware of what we look like, what we're putting out there, how we're acting in public, top things from my perspective. And then just to kind of, add to that is also the self-care for the professional, because we cannot manage people's grief and how they're going to react to us. There's a whole conversation about displaced anger, and just seeing, like, how people react and respond. So doing as much self-care as we can, because we don't know what the situation, it's always this unknown. What a family, how did their loved one, end up passing? How did somebody need senior care? So whatever their situation is, we need to be in control of the way, on top of our own game. So all my students will say, I'm always sitting there saying, stay hydrated, get enough sleep, because these type of positions are 24/7. People don't die between 8 and 5 Monday through Friday. And where do they think they're going to get workers on the weekends and on call? It's usually the new folks, which is usually the new students coming into the profession. So that's how I would kind of summarize, from my perspective, what the skill set is and what things to be, really taking seriously. If you have a lot going on in your own life, maybe now's not the right time to undertake such a daunting profession. And I would say to really examine it. I will leave you with one of the most alarming statistics that we refer to is that 50% of mortuary science graduates will not be in the field 5 years out from graduation, which is 1 out of 2. I mean, that's really an alarming statistic. And so
Yeah.
I'm doing my best to really, hopefully remediate that, and, make sure people are there for the right reasons and not be enchanted with, oh, I just want to work with the dead, because that's not the right reason. Senior
Yeah.
placement, very similar conversation.
Well, Tanya, this has been fantastic. And as a conversation around customer experience, it's been one of the most fascinating that I've had. So I thank you very sincerely for the time you've taken today. And if people want to find you on LinkedIn, I know that you're around. We will post a link to your LinkedIn profile when we do the upload of the podcast, when the podcast drops. But again, sincerely appreciate all the, not just the time, but the wisdom you've brought to the table on an area of customer experience that I think is not talked about enough, but certainly deserves more attention and more place at the table.
My pleasure. It's been an absolute pleasure to be with you this morning. Anyone can find me on LinkedIn and would love to have you on our podcast, Friends from Wild Places. My friend Shireen from South Africa. So would love to have you on as a guest.
I'll bring sign me up. I will be there. You tell me when and we will record.
Awesome. Awesome.
Thanks for listening to the CX Files podcast. We really appreciate your feedback and suggestions. You can reach myself, Mark Hillary, or Peter Ryan via LinkedIn. Please also leave a rating or review on your favourite podcast provider, as that helps more people to find us. As always, we'd like to thank Chris Haig at Traction Media for the CX Files graphics. See you next week. Hello and welcome to the... Sorry, I wasn't even thinking of it.